My name is Surad Basnet. I'm a graduate nurse, and this presentation is about violence in healthcare settings. Violence can potentially compromise safety of patient employees that can cause unhealthy working environment. Nurses are assumed to work in environment where they will be preserved with politeness, compassion, and respect. However, variety of aggression and workplace violence are tangible complications. In healthcare scenario, any form of violence should not be tolerated by any group or organization. This has become significant to current nursing practice. A study found that increase in excessive workloads while working in the environment with little faith and fairness, expectation of high demand of work were significantly associated to workplace violence. This study also reported that nurses with little or no experiences are potential to experience violence or recognized to be at high risk for horizontal violence. This leads to health professionals go through numerous stress which impact patient safety and create unhealthy work environment. Violence in workplace is still continuing and persistent in contemporary healthcare settings. It consists of a variety of behaviors, verbal aggression, physical threats, and abuse. It has always been a discussion about this issue to make an effective policy and implement to mitigate this problem. There are significant risks of workplace violence facing by health professionals, mainly in hospitals, nursing homes, mental health, and other healthcare settings. This has occurred when directly working patients with a history of violence under the influence of drugs and other illness. Emergency departments have the highest incidence of violence that healthcare employees experienced, while patients must go through long wait due to pain or other illness. Workplace aggression and violence has become widespread in healthcare sector. This includes every episode of threat, verbal abuse, assault that happened in situations related to health professionals which links patients, relatives, and public. Nurses and doctors face massive amount of direct contact of aggression and violence from different types of patients with background of drug and alcohol abuse, mental illness, such as in emergency department. Although nurses are principally exposed, it is recognized that violence has the possible to affect all healthcare workers and increase the risk of patient safety. If this occurs consistently in any healthcare organization, this will lead to poor health outcome, hospital readmission, increased length of hospital stay, and loss of public trust. Violence can have negative impact towards healthcare professionals, instigating mental trauma, stress, sadness, anxiety, distress, job dissatisfaction, helplessness, loss of confidence, loss of interest, burnout, and negative change in behavior. This will contribute to unhealthy and unsafe work environment that can directly affect patient safety. Healthcare institutes have the obligation to address, manage, and contain workplace violence. Being a graduate nurse, set of skills, training, and education is vital to become an effective leader to manage violence with understanding and anticipating the consequences. It is important that we must know and understand our responsibilities. Aggression and violence in any healthcare setting is serious issues and impact the delivery of care, safety of patients and employees that leads to unhealthy work environment. It is crucial that we anticipate if there is a potential to any intimidating situation. Nurses have responsibility to seek support and report to senior or team leader if you recognize that there is potential to aggression and violence. Always advocate and ensure safety of yourself and patients. It is our responsibility to care for ourselves in order to provide an effective care to others, so that we can care for others and support in every aspect. As a graduate nurse, it is best interest to learn more about this issue and get resources to create best practices in nursing. This cares about working together to create a safer and healthier work environment. It is important for nurses to practice safely and effectively within scope of practice in any situation while caring for patients. A supportive environment must be provided to allow new nurses to become good advocates, communicator to promote healthy environment. They should feel comfortable raising any issues during transition period, allowing any potential to be recognized and alleviated early. As an effective leader and as a graduate nurse, we can try to handle any violent situation with good strategy, being a calm and timely manner. Ensure safety of yourself, patients, employees, and the surrounding area. Approach other nurses for support and involve nursing unit manager, team leader, and escalate the issue. A good leader should establish a good verbal contact but not to be provocative, but be concise and keep the message clear and simple. The leader can use a range of skills to identify the person's requirement and feelings. Be an active listener and focus on what the person is saying. Victorian government announced Code Grey policy in response to prevention or minimizing of violent situation, which means all the hospitals are required to have this standardized policy in response to real or potential threat to prepare for any imminent threat. This type of initiative will support healthcare staff to provide a safer environment and minimize the risk of patient safety, injury to workers, family, and visitors, as well as reduce possible contact to violence and safeguard all patients to receive high quality, safe care. Nurses are bound by rules, regulation, legal and ethical framework with established standards. These rules are set to practice nursing care safely and accordingly within the scope of practice. According to NMB competency standards, the nurses should practice in line with standards to respond and identify dangerous practice, mandatory reporting to deliver an effective person-centered nursing care. While delivering care, nurses should apply nursing ethical principles, maintain professional boundaries, adhere to its duty of care within nursing scope of practice. According to NMB, when there is potential or ongoing aggression and violence, graduate nurses must be able to use a range of assessment techniques, collaborate with others to determine factors that affect or potentially affect, and prioritize for action. NMB Standard 6 and 7 covers to provide safe, appropriate, and responsive quality nursing practice that evaluates outcome by practicing within their scope of practice. Moreover, Standard 6.6 emphasized about uses the appropriate process to identify and report potential and actual risk-related issues where nursing practice may be under the expected standards that may compromise patient safety and create unhealthy working environment. It is understood that nurses are bound by ethical and legal responsibilities. However, aggression and violence in healthcare environment can bring negative impact that leads to poor nursing performance, stress, medication error, harm to patients and staff. Therefore, this type of significance needs to be addressed and recognized as early as possible by the relevant department. It is obvious that many researches have been conducted and will continue to be conducted on the topic of violence towards healthcare workers for a good purpose. Therefore, I have selected to present information on this issue. This issue has been a broader topic and it is still ongoing problems in contemporary health practice. Violence can cause mental trauma, stress, sadness, medical error, and many other issues, as I mentioned above. This will contribute to unsafe work environment that can directly affect patient safety. Health organization can set policies to deal with violent situations within the organization. I, as a graduate practice nurse, I will choose transformational leadership style as it empowers, motivate, aware, and inspire the employees to share goals to enhance patient care. This will enable to put policy in place. Policy should be based on de-escalation as violence may reoccur and comes from a variety of sources with different level of intensity. It should be widely distributed throughout the organization, easy to follow, understand, and reflective of the healthcare organization's culture. The organization must be supportive towards the healthcare workers. Their help should not be limited to legal aid, must address with compassion and sympathy for people who are injured or were part of any incident. Thus, the leader can minimize or resolve any unforeseen violence incident. Additionally, I would prefer to provide education to spread awareness and training about how to deal with workplace aggression and violence for all the employees who work directly and indirectly within the organization. In-service program and distributing brochures can also support to identify and mitigate potential problems. I must be proactive, initiative, and collaborative about quality improvement and provide safe care to create healthy work environment. However, further research needs to be continuing to focus on designing and implementing an appropriate program, support services, and their impact on nurses in contemporary health practice. These are the references. Another page for the references. This is the last page of references. I hope you like this presentation. Thank you so much.